right. Can you hear?
Yep.
Okay. So Alicia, today we are going to do a really thorough check of your gum tissue because we know just because your teeth are healthy and they don't have cavities, that doesn't necessarily mean that your whole mouth is healthy. So we want to assess the support structures, what's holding your teeth into your mouth. Okay?
Okay.
And to help you understand what it is I'm doing, I have this visual aid. So we've done this chart before on you, and what we do, we take our little probe, it's calibrated in millimeters, and we go under your gum tissue, and this is a space called pocket. The smaller the pocket, the better, really. So 1 or 2 millimeters is desirable. You can clean out 1 or 2 millimeters with floss at home. You can see here that this gum tissue is nice and pink, fills in those spaces, there's no inflammation. And on the x-ray, you can see that the bone level fills in between the roots and it comes up nice and high on the tooth. That's what we want. Now, have you heard of gingivitis?
Mm-hmm.
Okay, so gingivitis is kind of its own unique category because the bone level is healthy. You can see here, it's nice and high, just like this one. But the gum tissue will have some bleeding. So again, we're not going to see a deep space here, maybe just 1, 2, 3 millimeters. But when we probe around, this gum tissue will bleed. Then you can see in the picture, it's more of a red color than up here with that nice coral pink that we like. Now, have you heard of periodontitis?
No.
Okay, so whereas gingivitis is gum tissue infection, periodontitis is bone infection. So even if you've lost 1 millimeter of bone somewhere in your mouth, that means you have bone loss. So what we want to know is how much bone loss do you have. We can look at your x-rays and see if it's just a little bit of change right there. This gum tissue is a little more red, especially down here. You see how it's kind of puffy, really irritated right there. So when we probe in these patients, we might see 4 millimeters. And that's kind of our cutoff, 3 to 4. When we go from 3 millimeters to 4 millimeters, we know that the bacteria changes from oxygen breathing to non-oxygen breathing. That's the bad stuff. When you get into moderate periodontitis, again, we're going a little bit deeper, maybe 5 millimeters. That gum tissue looks really irritated there, and we've lost even a little more bone. We would like it to be right about here. Advanced periodontitis, we're looking at 6 or more millimeters of bone loss. You can see here the gum tissue has receded. This is actually root structure that's exposed, and this gum tissue is just very inflamed. It's not happy with gum tissue. And if you look on this x-ray, the bone level right here, that's half of the tooth that is now not being held up by bone. So this is how you could lose a perfectly healthy tooth because there's no bone holding it in place.
That's pretty gross.
Yeah, it is. So when I lay back, I just want you to listen to those numbers. Sarah's going to chart for us. So if you hear 1s, 2s, and 3s, you can kind of picture you're up in this area. Anything above a 3 is going to be an area that we're a little concerned with, and also areas of bleeding. Okay, any questions?
Nope.
Okay, perfect. Now when I lay back, try to stay open so that I can chart any areas of bleeding so that your saliva doesn't wash it away. Perfect.